This is a presentation about antibiotics. We will be covering fluoroquinolones, aminoglycosides, penicillins, and nursing interventions in regards to antibiotics. Fluoroquinolones are broad-spectrum antibiotics that work by interfering with DNA to prevent growth and reproduction and then causing cell death. The generic names of these medications are influoxin. Here's a list of examples, with two of the most popular being ciprofloxacin, which was seen in the second case study, and levofloxacin, or Levaquin. Fluoroquinolones are used to treat skin, respiratory tract, and urinary tract infections. This class of drugs is widely known for treating hospital-acquired pneumonia. They can also be used in the prevention of anthrax and against typhoid fever. Ofloxacin can also be used for eye and ear infections. These drugs are absorbed in the GI tract, metabolized in the liver, and excreted in the urine and the feces. These drugs are usually given intravenously or by mouth. People who should not get these drugs are anyone with an allergy to it, pregnant and lactating women. Also, children should not take these medications because they have been associated with developing lesions inside of the cartilage. Caution should be taken with patients with renal impairment or seizure disorders. There are many drug interactions, but two important ones are theophylline, could increase in serum levels and cause toxicity, and antacids will affect absorption. And here's a picture about ciprofloxacin. These are some common adverse effects that we will tell our patients about and watch for: dizziness, headache, insomnia, GI upset, including nausea, vomiting, and diarrhea, also hepatotoxicity and dysrhythmias, because these medications can prolong the QT interval. There is also a black box warning on these drugs about possible tendinitis or tendon rupture. This risk can be increased if the patient is also taking a corticosteroid. These nursing interventions are specific to fluoroquinolones, but other nursing interventions pertaining to antibiotics should also be completed. We should teach our patients taking this medication to use protective clothing and sunscreen when outdoors, not to take with antacids, and if tendon pain develops, contact the healthcare provider. We also need to be careful in assessing for cardiac dysrhythmias because of the risk of future dysrhythmias with prolonged QTs. These medications should also not be given too quickly because they could drop the patient's blood pressure. Here's a question I found about ciprofloxacin. A client received Cipro twice daily for a urinary tract infection. Which client finding should concern the nurse the most? The answer is B, frequent watery stools, because the client is at risk for developing Clostridium difficile.
Aminoglycosides. Aminoglycosides are a class of antibiotics that are considered to be narrow spectrum. This means that they are effective against specific families of bacteria rather than a wide variety. They are used to treat infections of primarily aerobic gram-negative bacteria. Aminoglycosides are also considered bactericidal. This means that they kill the bacteria rather than prevent growth. Studies suggest that this is accomplished by leakage of cell contents through the bacterial cell wall after the insertion of abnormal proteins. Additionally, aminoglycosides attach themselves to the ribosomal unit, thereby disrupting protein synthesis of the bacterial cell. The amount of bacteria killed is based on the concentration of the antibiotic. The higher the concentration, the quicker the infection will resolve. The most commonly used aminoglycosides are gentamicin, tobramycin, and amikacin. Others are listed in the table below. Pharmacokinetics of aminoglycosides. These antibiotics are highly polar cations. Their strong positive charge inhibits them from readily crossing membranes. That being said, much of the antibiotic, when administered orally, stays within the GI tract. In cases of systemic infection, these drugs must be administered parenterally. Once aminoglycosides are in circulation, they bind strongly with renal tissue, so much so that when compared to serum levels, the levels present in the kidneys can be up to 50 times higher. Thus, these antibiotics are highly nephrotoxic and levels need to be monitored. In addition to accumulating in the kidneys, aminoglycosides also distribute readily to the lymph in the inner ear. This is a big concern because they can become ototoxic. These drugs are not metabolized and are excreted rapidly by the kidneys, cross the placenta, and are in pregnancy category D, which poses risks to the fetus. Indications for aminoglycosides. As mentioned before, these antibiotics are effective against gram-negative bacteria. They are used to treat serious infections of Pseudomonas aeruginosa, E. coli, Klebsiella, Proteus mirabilis, and others. They are also used in combination therapy against Staphylococcus aureus. Gentamicin is commonly used for open wounds and ulcers. Neomycin is used topically for infections of the ears, eyes, and skin. Tobramycin via nebulizer is used for management in patients with cystic fibrosis. Kanamycin and neomycin are used to suppress flora in the bowel preoperatively for indicated surgeries, as well as for treatment of hepatic coma. As with most drugs, aminoglycosides are contraindicated in allergy. Because of their nephrotoxic capabilities, they are also contradicted in people with renal disease. Furthermore, their ototoxic effects cause it to be contraindicated in people with pre-existing hearing loss. Aminoglycosides have effects on normal defense mechanisms and are therefore contraindicated during active infection with herpes and with mycobacterial infections. Particular aminoglycosides can have effects on the central nervous system, inhibiting neuromuscular junction transmission, and result in exacerbations in myasthenia gravis and Parkinsonism, thus are contraindicated in both. Aminoglycosides can cross the placenta, and their negative effects can impose on the fetus, so they should be used cautiously during pregnancy, only when the benefits outweigh the risks. Adverse effects of aminoglycosides are closely related to ototoxicity, which includes impaired hearing, tinnitus, and impaired balance, and nephrotoxicity, which includes proteinuria, casein urine, dilute urine, and increased blood in creatinine. Some aminoglycosides, such as streptomycin, can cause optic nerve damage and paresthesia. Superinfections are found to occur with the use of neomycin, and kanamycin, if used longer than 7 to 10 days, can cause bone marrow depression. The serious adverse effects of aminoglycosides become more concerning if they are used with drugs that could increase these effects. Use with diuretics, for example, will increase the risk of ototoxicity, nephrotoxicity, and neurotoxicity because the loss of fluids would increase the concentration of the antibiotic present. Penicillins, cephalosporins, and ticarcillin all have synergistic effects. Lastly, because of the effects that particular aminoglycosides have on the CNS, there is an increased risk of paralysis when used with anesthetics and muscle relaxants. A patient using these together should be monitored closely for respiratory depression. Other nursing considerations include monitoring for ototoxicity and teaching the patient to report early signs of damage to the cochlea and vestibule. These early signs include headache, nausea, unsteadiness, dizziness, and vertigo. Because the damage from ototoxicity is largely irreversible, patients should stop using the drug at the first sign of damage. Kidney damage may occur while using aminoglycosides, but patients should be informed that it is usually reversible once the drug is stopped. However, it is still important to monitor blood and creatinine levels while the patient is taking these drugs. Ensuring adequate hydration can help to decrease these toxic effects. Lastly, if a patient requires surgery while taking aminoglycosides, it is important to make an obvious note on the patient's chart indicating that they are taking these drugs. Here is a question I found to check your understanding. An aminoglycoside antibiotic might be the drug of choice in treating A. Serious infections caused by susceptible strains of gram-negative bacteria, B. Otitis media in an infant, C. Cystitis in a woman who is 4 months pregnant, or D. Suspected pneumonia before the culture results are available. The correct answer is A. Serious infections caused by susceptible strains of gram-negative bacteria. It wouldn't be B because amoxicillin is the preferred antibiotic in treating otitis media. It wouldn't be C because aminoglycosides could be contraindicated in this situation. And it wouldn't be D because aminoglycosides are narrow-spectrum antibiotics, and a broad-spectrum antibiotic should be used when treating suspected pneumonia while waiting for the results to come in.
Penicillin and penicillinase-resistant antibiotics are mostly effective on gram-positive bacteria, although as a class they are broad-spectrum. They work by interfering with the ability of susceptible bacteria to build their cell walls when they are dividing. The generic names of this class end in "cillin." We have all seen penicillins before. Our parents gave it to us as children to treat infections, and we've even seen it in our OB clinical because we give penicillin G to expecting mothers if they have group B streptococcus. Some indications for this class of antibiotics are a broad spectrum of infections ranging from streptococcal infections to fusospiricidal infections. We also see this class used to treat rat bite fever, diphtheria, anthrax, syphilis, and others. Penicillin and penicillinase resistant antibiotics are absorbed in the GI tract and excreted in the urine. It should be known that if you are allergic to penicillin or cephalosporins, you should not be taking this drug. Be cautious with renal disease, especially since this class is excreted in the urine. We want to be sure that the drug is being used as safely as possible. And as with the majority of drugs that we discuss in this class, be cautious if you are pregnant or breastfeeding. Some adverse effects associated with this class of antibiotics are nausea and vomiting, furry tongue, sore mouth, yeast infections, diarrhea, and abdominal pain, to name a few. There may also be some pain and swelling at the injection site. There are a couple of drug-to-drug interactions to be aware of with penicillins. First, if paired with tetracyclines, it will decrease the effectiveness of the penicillin. Second, inactivation of aminoglycosides happen when the parenteral form of this class is paired with parenteral aminoglycosides. Now, moving on to nursing interventions, we always want to make sure that we are giving this class of antibiotics on an empty stomach to promote absorption because they are extremely sensitive to the gastric acid levels in the stomach. Moreover, like I said before about the kidneys being very important in the safe use of this drug, we want to make sure we are doing renal function tests and also frequently checking the BUN and creatinine. Before giving penicillins, we also want to make sure to check culture and sensitivity to make sure this is the drug of choice for that patient. Make sure that the patient completes the entire course of antibiotics and drinks plenty of fluids. Lastly, you want to monitor the injection sites regularly for any adverse effects that may happen.
So, to begin with, it's important that one views over the patient's tests, particularly in regards to the bacterium from culture. Another test to view over is sensitivity. These both help to determine the correct antibiotic or combination of antibiotics to utilize in treatment. Then it's also imperative to take note of the clinical manifestations that become present from the patient's infection. The reason as to why is because they'll help to determine whether the antibiotic or antibiotics are effective. If there was a fever present, for example, has the patient's temperature gone down since treatment? If not, another culture might be taken to start the patient on a different antibiotic. Another significant component to monitor is peak. In order for treatment to be efficient, it's necessary for concentration of that antibiotic or antibiotics to be at a certain amount within the blood. Other significant parameters to incorporate within assessment include tests which determine the function of certain organs. These organs are involved with excretion, the kidneys, metabolism, the liver, and hearing, the cochlea. Nephrotoxicity and ototoxicity, for example, could occur with antibiotic use. These adverse effects could especially occur if the patient is of the elderly population due to aging effects of the organs. or if the patient has a dysfunction or impairment of the kidneys or liver. Since bone marrow suppression is another complication from antibiotic use, it is important to monitor complete blood count as well. In addition, the patient might experience unpleasant sensations such as tingling or disorientation. Therefore, he or she can become at risk for injury. With antibiotic use, education plays a major role in whether treatment will be effective. Instruct the patient about the importance of adhering to the medication regimen, correct dose, specific time, and to finish the medication given. Stress that, yes, he or she needs to take the antibiotic to its entirety, even if he or she doesn't feel sick. Otherwise, a resistant strain of the bacteria could arise and, thus, make the medication ineffective against it. Nutrition is another key component during treatment. Since the patient might present with some GI symptoms, such as vomiting, inform him or her to have food more often, but in smaller portions. Hydration is a third important component for a patient on antibiotics. From use of these medications, or even from the infection itself, the patient could have diarrhea. Diarrhea could lower the electrolytes and bodily fluids. Therefore, an increase with the patient's intake of fluids might be necessary. To prevent injury while on antibiotics, make sure to offer the patient help if he or she decides to ambulate. Then, when the patient is in bed, raise the side rails to promote safety. For the fifth bullet point, provide candy or ice to help the patient if he or she complains or has those problems, such as dry mouth, etc. As a side note, the candy that is given to the patient should not have sugar in it.